For the invitation. I apologize that I can't be there in person. Hopefully next year I can join in person and we can engage, which will be really lovely. Today I'm going to provide about a 10-minute update on antibiotic stewardship. And next slide. I have no disclosures. Next slide. And today I'll be describing the CDC's Office of Antibiotic Stewardship ongoing activities, leveraging antibiotic use data across the healthcare settings. And I'll also identify CDC resources for antibiotic stewardship. Next slide. Ensuring appropriate use of antibiotics or antibiotic stewardship is one of CDC's 5 core strategies to combat the threat of antibiotic-resistant infections. Next slide. Most of you know the hospital core elements of antibiotic stewardship is the framework that CDC released in 2014 and updated in 2019. The core elements outlines the structural and procedural components that are associated with a successful stewardship program. The 7 core elements include leadership, commitment, accountability, expertise, action tracking, reporting, and education. This figure, we just developed this on our team to really highlight that the core elements are not meant as individual, independent components, but as a comprehensive framework for the implementation of antibiotic stewardship. This process by which stewardship programs then can implement the core elements should be dynamic, with continuous evaluation to assess outcomes of stewardship interventions, monitored for unintended consequences, and identify new stewardship activities. Next slide. The core elements are intended to be an adaptable framework that hospitals and other healthcare settings can use to guide efforts to improve prescribing. Since 2014, the core elements have been released for nursing homes, outpatient, small and critical access hospitals, and resource-limited settings. And these documents take into account the unique challenges and resources in these different settings. Next slide. I thought it would be high yield to frame this brief update as 5 ways to be antibiotics aware in 2023. This is a common approach that we use in many of our communication materials. So today I'll provide 5 updates, the 5 ways. The first update will be to the antibiotic resistant and patient safety portal. The second will focus on priorities for hospital core element implementation, the NHSN AUR module for the CMS Promoting Interoperability Program, new and evolving stewardship practices, and lastly, U.S. Antibiotic Awareness Week 2023. Next slide. First, we'll talk about the updates to the antibiotic resistance and patient safety portal. Next slide. For those that are not familiar, the portal is an interactive web-based application that displays data collected through NHSN, the Antibiotic Resistant Laboratory Network, and other sources. The portal offers enhanced data visualizations on antibiotic resistance, use, and stewardship. Next slide. The next several slides are actually screenshots from the portal, specifically focusing on the posts that we do for inpatient and outpatient antibiotic use data. And then we also post the uptake of the core elements in hospitals and nursing homes on the portal. And we typically conduct our annual updates So they coincide with U.S. Antibiotic Awareness Week, and so our releases typically occur in November every year. Next slide. Here you can see the number and percent of hospitals meeting all 7 core elements that are reported to the NHSN Annual Hospital Survey from 2014 to 2021. So the hospitals self-report to the survey, and then we map to determine if they meet the individual core elements. In 2021, nearly 95% of over 5,000 U.S. hospitals had an antibiotic stewardship program that met all 7 of the hospital core elements. Next slide. Here you can see the number and percent of long-term care facilities meeting all 7 core elements that were reported to the NHSN Annual Facility Survey from 2016 to 2018. Now, this was just launched this past fall, and we are actively working on posting 2019 to 2021 data by the fall. Next slide. We've had rates of antibiotic use in the outpatient setting for many years pasted on the portal. And you can see specifically here, it's based on state and class that are annually updated. Next slide. This past fall, we also launched hospital antibiotic use data to the portal, and it is specifically from hospitals that are submitting to the NHSN antimicrobial use option. And we utilize the standardized antimicrobial administration ratio, or the SAR. Many of you are familiar with this. This is our risk-adjusted summary measure. And we know that many hospitals are really enjoying having these data on the portal, as well as health departments, because then you can use our SAR to compare their AU to the state distributions or other hospitals in terms of like at the state level to help identify meaningful SAR targets. Individual data is not posted. Next slide. With nearly 95% of U.S. hospitals having antibiotic stewardship programs that met all 7 hospital core elements, the ones I just presented, the CDC released this past fall what we call priorities for hospital core element implementation, or we call it priorities for short. And this can help enhance the quality and impact of existing antibiotic stewardship programs. Next slide. The priorities are derived from the hospital core elements, and they highlight a subset of effective stewardship implementation approaches that are supported by evidence or recommended by stewardship experts. Next slide. And the priorities provide hospital leadership and antibiotic stewards opportunities to expand their antibiotic stewardship programs. Many hospitals state that they already have the uptake of all 7 core elements, and so this provides opportunities to further expand your program. The CDC identified implementation priorities for 6 out of the 7 hospital core elements. And on the previous slide is a screenshot on our website that go through each of the priority core elements. And just for the interest of time, if you want to learn more about that, you can click on this link and it will go through all the individual priorities. The priority core element uptake has been added to the patient safety portal this past fall. Overall, 9.5% of hospitals are meeting these 6 priority elements in 2021, with the highest uptake of the pharmacy expertise and action core elements, and the lowest being tracking and reporting. Although, next slide. Though only 9 0.5% met all of these 6 priority elements. Nearly half of the hospitals met 4 or 5 of the priority elements in 2021. Thus, we believe that hospitals can improve the uptake of the priority core elements in the upcoming years. And then it can serve as a target for hospitals to enhance their programs. The third update that I wanted to provide are the implications of the CMS Promoting Interoperability Program, or the PI program, as we call it for short, for the NHSN AUR module. Beginning in calendar year 2024, the AUR module data are required under the Public Health and Clinical Data Exchange objective of the CMS Promoting Interoperability Program. This applies to eligible hospitals and critical access hospitals that participate in the CMS PI program. It's important to note that measures include submissions of both AU and AR option data. And for calendar year 2024, facilities will need to attest to either being active engagement with NHSN to submit AUR data or claim an applicable exclusion. Okay, so that's a lot. As a quick disclaimer, our guidance is posted on the final rule CMS published last year, and the PI program materials that CMS has posted for the calendar year 2023 measures. The CMS has not published materials for calendar year 2024, and that includes the AUR measure. Additionally, CMS is currently in the middle of the fiscal year 2024 rule-making cycle. So while it's technically possible for things to change for the AUR reporting measure, nothing in the proposed rule points to that direction. Next slide. So the NHSN AUR team, they have posted a quick reference guide that walks facilities through the steps to get credit for the PI program. The team will be posting additional materials such as a recorded webinar, FAQs, and operational guidance in the upcoming weeks. If you have questions about the AUR reporting measure, please reach out to the NHSN help desk at the standard email, nhsn@cdc.gov. And if you put in the title of the email specifically the topic, then that can be directed to the optimal individuals faster. And so we plan to do a lot of outreach and education this upcoming year for the CMS PIP program. Our team at the CDC is also working on new stewardship guidance. Next slide. As you all know, the landscape of healthcare is constantly changing. Urgent care and telehealth are growing methods of healthcare delivery. So we are engaging with partners working in those settings to provide guidance and resources for stewardship implementations. We are currently working on guidance for antibiotic stewardship in the outpatient telemedicine that will be published soon. Next slide. Another important partner are the state and local health departments, like the Illinois Health Department having this great webinar for me for your face-to-face conference. Health departments can play an important role in guiding stewardship efforts in the various healthcare settings and promoting appropriate antibiotic use, as Jamie just highlighted of all the great activities Illinois is doing. A portion of the COVID funding, supplemental funding, was dedicated to antibiotic stewardship, and it does what we feel provides access to stewardship expertise in the health departments, and that can especially support settings where inequities in stewardship support exist. And along these lines, our team at the CDC are creating core elements of antibiotic stewardship for health departments. We have a draft that will be undergoing clearance in probably within a month, and so our plan is to hopefully launch for U.S. Antibiotic Awareness Week this upcoming fall. Next slide. In 2021, CDC launched an agency-wide strategy to integrate health equity principles into public health programs, policies, data systems, and funding structures. Our office conducted a scoping review of published studies to characterize antibiotic prescribing health inequities. And data are being analyzed to identify variations in prescribing practices that could be contributing to health inequities. We are really focused that antibiotic stewardship policies and strategies need to factor in health equity to ensure stewardship interventions don't exacerbate inequities and strive to ameliorate them. Next slide. And along these lines, so our stewardship community can learn more about health equity, CDC is partially supporting SHEA's one-day educational program for clinicians, stewards, IPs, and public health for a workshop entitled Advancing Health Equity Through Antibiotic Stewardship. This is an in-person meeting in Atlanta, Georgia on September 6th. So it may be challenging for many of you to attend in person. The good news is that it will also be recorded and posted online, hopefully by U.S. Antibiotic Awareness Week. But if you can get to Atlanta, I would encourage you to register. There's no fee for this meeting in terms of the registration to attend. Okay, the final update is on U.S. Antibiotic Awareness Week. I think many of you are familiar that U.S. Antibiotic Awareness is our annual observance that raises awareness of the threat of antibiotic resistance and the importance of antibiotic appropriate use. Next slide. We're going to focus on that all healthcare professionals can be antibiotics aware and emphasize this in our resources and in our activities. Next slide. Our team is working on organizing all the different stewardship resources into bundles that are specific to different type of healthcare settings and professionals to be promoted during U.S. Antibiotic Awareness Week. This is an example of a transition of care bundle. Therefore, at your facility, if you would like to focus on transition of care for messaging or education or providing materials, we'll have it in this bundle, at least what we have either within our material we've created or potentially, and this is an example where we funded a project with Henry Ford and we've linked to their project as well. Next slide. Many of you have probably taken our CDC training on antibiotic stewardship. We have been updating it and renewing the CE this past year. Most of this training is focused on outpatient antibiotic prescribing. However, there are many modules that can be useful for healthcare professionals in other settings. For example, we have a module on hospital as well as nursing home stewardship. And this does provide 8 hours of complementary CE for many different disciplines. So definitely, if you need some CE, I encourage you to take some of these courses, as well as I typically have my students and residents partake in this as part of their rotations with me. Okay, once again, thank you for this opportunity. I do encourage you to go to this website during late summer, August, early fall, and we will be updating resources and activities for U.S. Antibiotic Awareness Week. We have annual CDC Federal Office of Rural Health Policy webinar for critical access hospitals. We partner with professional organizations also to have more webinars and podcasts and Twitter storms. And so all this great information will be posted soon. Thanks again. Hope you were able to hear me clearly. I've been trying to talk really loud here, and hopefully next year I can be in person and meet you all.